Olivia, and today I'm trying to find out what mental capacity is. I can't really wrap my head around it. So today I'm here with Dr. Chen, who will be explaining to me what mental capacity is. So Dr. Chen, tell me a bit about yourself.
I'm a doctor who actually focuses on vulnerable groups, particularly persons with dementia as well as persons with intellectual disability. So those are my two areas of interest and my areas of passion.
So Dr. Chen, what is mental capacity?
Well, I guess you can see mental capacity really as the ability to make decisions. All of us have the ability to make choices and decisions in our life, and that is our decision-making capacity as well as mental capacity.
So why do we have this concept and why is it important?
Well, I guess if you think about it, it is actually really an essential part of living, right? Like from the moment you wake up today, you had to make decisions, you had to make choices, and all of that is really just part of our daily lives. And so every single day, every single one of us has to make decisions, and that's why it is so important to all of us.
So when it comes to making such decisions, are there any legal aspects that we should take note of?
Decisions could be big, decisions could be small, and there are some decisions in which there are definite legal components and legal impact to it. So for example, whether or not you sell your house, for example, whether you make your will and will your assets to someone else, all of that is actually legal in nature. So therefore, there is definitely a legal aspect to making certain decisions.
Is it only doctors like you who need to care about mental capacity?
Definitely not, right? Like what we've already said just now, it is very much a part of life. So all of us need to understand what mental capacity is all about, what it means to make decisions. It's important for us on our own because we have to make decisions, but there may be times in our lives in which we have to also make decisions on the behalf of someone else, and that is when it is even more critical because we need to understand, that role and what it means to actually have to make decisions on someone else's behalf, which is a huge responsibility.
So is there a law defining what mental capacity is?
In Singapore in 2008, actually there was the Mental Capacity Act that was actually established and passed in Parliament. And actually what that act actually really does is that it tries to safeguard people who have difficulty making decisions for themselves. So what it actually does is that it allows people who have decision-making ability to actually appoint someone else to actually take charge of their affairs if they lose mental capacity one day. What it also does as well is that, because as you can understand, not everyone will have mental capacity currently, right? There will be people who already don't have decision-making ability. So what that law actually does as well is that it allows the court to appoint some people called deputies to make decisions for these people who already do not have that decision-making ability. So that is the Mental Capacity Act.
So if a person has depression or if the person is suffering from dementia, does this mean that the person has no mental capacity?
I think the most important thing to remember about mental capacity is that we must first presume capacity. So every person that we meet, be it whether it's a person without any medical condition or a person with dementia or depression or intellectual disability, we must first assume capacity. Then after that, we must then ask ourselves whether they have a medical condition that can affect their decision-making abilities. And the question that you're asking, whether or not a person with depression or dementia can have problems making decisions, it will actually have to be assessed. Because there will be people who have depression and dementia who have full decision-making ability. But there will also be those who will have difficulty making some decisions. So actually, it's all on a spectrum.
So how is this spectrum determined?
It is really determined by a few things. One, of course, is that we have to look at the medical condition of that particular person and the severity of the condition. For example, if you look at a person who has mild dementia compared to a person who has more severe or advanced dementia, then clearly, you will be a little bit more concerned about the decision-making ability of the person with more severe dementia. But that doesn't mean that the person with more severe dementia doesn't have decision-making ability, because decision-making ability is decision-specific. So what does that mean? It means that perhaps the person now with more severe dementia may have difficulty making a decision about where to put their money in terms of stocks and shares. But that doesn't mean that the person cannot make decisions with regards to what he or she wants to eat for that day or where they want to go that day.
So to clarify, does this mean that decision-making is specific to the situation?
Yes, you're right. It's actually specific to the situation and also specific to the decision. So if you think about it, there are actually 4 steps that we actually take where we try to assess whether a person has decision-making ability for a particular decision. First of all, the person must be able to understand the information that is being given to that person. Secondly, the person must be able to retain that information. Thirdly, the person must be able to weigh and judge the different choices. And then fourthly, the person must be able to communicate back the decision that they have made. So these are the 4 things that actually need to be done when we assess a person's mental capacity. So if you think about it, the type of information that a person requires if they want to sell their house, for example, or renovate their flat, for example, will be very different compared to the information that the person requires if I want to ask the person whether they want to drink coffee or tea. So therefore, it definitely is different and it is decision specific.
So does making bad decisions count as mental incapacity? So let's say if I decide to spend my night gambling or my money away, is that a bad decision? Is that mental incapacity?
That's a really good question. And I think this is a really important point to make as well, that an unwise decision, which is probably what you did if you spend your night gambling away, does not equate not having decision-making ability. So that's exactly what it is, that sometimes we make unwise decisions, but we actually are fully cognizant of the decision that we're actually making.
Let's say my grandmother, when she has dementia, sometimes she has good days and bad days. So let's say on her bad day, she might be totally incapable of making proper decisions or going about her daily life. So what do I make of this?
So I think we must see that decision making is actually on a spectrum, like I said earlier, and also there may be conditions that can actually cause what we call fluctuating mental capacity. I think to understand it in a very practical way, it is that, for example, if you have a bad headache on a certain day, right, you will find it more difficult to concentrate, isn't it, when people give you information and you need to make a decision. So similarly, for people who already have got an underlying condition like dementia or intellectual disability, some days are just not as good as other days. A simple example I would give you is, for example, just before I came today, I was seeing one of my patients with Down syndrome, intellectual disability and dementia. And when he came to see me today, he refused every single thing. He wouldn't even want to say a word to me. But does that mean that he does not have decision-making ability at all, just because it's a bad day for him? The answer is no. What I will actually need to do is to assess the reason for this particular bad day, and then try and address some of the questions and decisions that he needs to make again on a better day, just like on a day when you don't have a headache.
So other than waiting for my grandmother to have a good day, how else can I support her?
The idea is that we want to preserve autonomy and choice as much as possible for any individual, regardless of what medical conditions they have. And in fact, in spite of what medical conditions we have, that's what we want to preserve. So for your grandmother, for example, if she has dementia, and if let's say the dementia causes her to have some difficulty understanding certain things, but it helps her, but she requires perhaps a more visual approach like pictures or a communication in a language of her choice, perhaps a language that she used to speak in her younger days, then we need to give her those things. We need to give her the information in that way so that she can understand it in the best way possible for herself. So essentially, in order to help people to make decisions for themselves as far as possible, we need to give them every avenue to try to understand the decision, every support they require to weigh the pros and cons, and every help they require in order to be able to communicate that decision that they have finally made. So that's what we really need to do for every single one of them. And I think the key thing to remember is that everyone is different. My grandmother also had dementia, your grandmother has dementia, and so many people out there have all these conditions, but they are all different. So we have to be very, very person-centered in the way we actually approach this and work with each of the individuals.
Wow, that's a lot of information. What if I can't remember everything and I want to remember one thing that you said today?
Then you have to speak to me again. That's what you need to do. Yeah, but I think that the really, really important thing is that you have to remember, and everyone should remember, that choice and autonomy is a really, really critical part of being human. We all want to be able to make choices, and we all want our choices and our decisions to be respected. And we all want to be seen as individuals and to have dignity in that sense. And I think that is something we must preserve as much as we can. But a very, very important thing as well that we must remember is that today we are talking about this particular topic because we are talking about vulnerable populations. People who may have difficulties making decisions. What does this mean? It means that they are vulnerable. It means that they are also open to being abused. And I think that is where that very fine line actually is. That we have to balance the need for autonomy and choice with safeguarding, so that ultimately they can live with dignity.